Back pain is the most common spine disorders patients come to see a physician. And spinal disorders are not only complicated, but also are the leading cause of disability and loss of productivity. So that's why we formed the Spine Center at the Rush University Medical Center. In our comprehensive care center, we included multi-specialty providers, including physical medicine and rehab physicians, neurologists, neurosurgeons, and nurse practitioners for the coordinated care.
Patients are going to get an individualized treatment plan through an interdisciplinary lens. So you're going to have surgeons, non-surgeons, therapists, everyone weighing in to create a plan for a specific patient and their problem to get them to where they want to be. You're going to get Rush. This is an institution that has invested a lot into making patient outcomes matter. You're going to get high quality, safe care here, and you're going to get outcome-based metrics. Back pain is very multifactorial, and there are typically a variety of causes of back pain even in the same patient. And so one of the things that we do pretty well is help chip away which elements of the back pain are most inhibiting their functional well-being. And I think one of the keys for us is that when we evaluate a patient, we're not trying to say, look, we're going to get you pain-free, because that's not a great goal. Rather, we want to say, what do you want to be able to do, and how do we get you there?
For most patients, we do not need surgeries, and will provide a non-surgical comprehensive care. And this including medication treatment and supervised physical therapy for back education, and body reconditioning, and functional improvement. We can also provide injections, and such as ultrasound or fluoro-guided injections for joint injection, nerve blocks, epidural injections. And then eventually we can offer radiofrequency ablation.
It may include medication, it may include non-pharmacologic modalities, but it's all about trying to hone in on what's causing the greatest source of pain and the greatest source of impairment to their daily function. And so for us, I think that's a really important element as being part of the spine care team. People are familiar with x-rays, MRI, which can be beneficial and part of a diagnostic workup, but frequently a very detailed physical exam is more important than any imaging modality. The other nice element of what we're able to do is utilize our physical therapy colleagues to help work with our diagnostic abilities to say, like, hey, we think it's this, can you try this modality, whether it's electrical stimulation or ultrasound or something like that, to say, can you see if that helps with their pain management or their issues. Because we have such good relationships with our surgical colleagues, we're able to work to create a pre-surgical rehabilitation plan for them. So we can come up with, okay, you're going to be doing this particular surgery. We're going to focus on strengthening these muscles, work on these transfer techniques before they even go to the operating room, so that by the time they come out of surgery, they've got a huge advantage in their recovery. And it's kind of focusing on all those little pieces that affect a patient's ability to get back to their normal routine. And for us, we can help oversee a physical therapy course, but we can also help say, all right, your pain isn't well controlled after the surgery. What are we missing? And come up with a treatment plan specifically for a new pain that wasn't there before surgery. I think the most important thing I do with patients when I see them is kind of walk them through how they got here and what we can do going forward. Spending a lot of time setting expectations and goals is, I think, paramount to success in back pain patients. So a provider sending someone to our program should feel very comfortable that the patient is going to get what's right and what the evidence supports. When you send someone to see us, they're going to get treated with dignity and respect, and they're going to get treated as a person. They're not going to get treated as a diagnosis, as a scan. They're going to be seen and treated as the person that you sent, not just as another number in our queue.